How you doing, Dr. Ulysses Jackson? Welcome back to another Mental Health Monday, where today we're going to discuss identifying and managing stress. Now, we're coming up on this holiday season right now, and for the next, I believe, 3 months, it's going to be a holiday or a special occasion for the next 3 months. And that's going to add to a lot of people's stress and anxiety, and some of us going to go into that seasonal depression, missing some loved ones. So I want to tell you some ways to identify and manage stress today. And again, welcome back to another Mental Health Monday. So November's going to be moving. November's going to be moving pretty fast. We're going to blink our eyes, and we're going to be at that dinner table with that turkey for those that eat that, At the blink of an eye, Christmas is going to be here. We're going to be stressed out about what we're going to get our loved ones, what we're going to get our children, and things of that nature. And then right after that, we're going to wait 5 to 7 days, and then that ball going to be dropping. We're planning for that New Year's. And right after January set in, it's Valentine's Day for those loved ones. So these are the time of the year where some therapists consider this seasonal depression, missing a loved ones, not being in a relationship, having the burden of taking care of kids and situations like that. So when we look at identifying and managing stress, we're going to look at it saying we have to define stress. And somebody may say, I'm stressed out. According to the DSM-5, the Diagnostic Statistical Manual for Mental Health, it's going to state that your stress can be mild, it can be moderate, or it can be severe based on other criteria. So we have to identify what is stress, and we're going to break that down to how we figure that out. That's one of the first steps. So according to the DSM-5, stress is also connected with trauma and stress-related disorders. So you could be stressed out because of a past event that you've been identified of having post-traumatic stress. Then it's another scenario where you could have acute stress, which at moments of times, things can stress you out. So we have to identify where the stress is coming from. Adjustment disorder. Adjustment disorder is situations such as you're adjusting to being out of a relationship. You're adjusting to being in a relationship. You're adjusting to going back to school. You're adjusting to not going to school. And then you have your reattractive disorder, which is more based around children and disinhibited social engagement, and then unclassified stresses and trauma disorder. So as you see on the screen, those are areas in which people usually stress out the most about. The next, we have to look at what is the impact that stress has on the physical body, such as high blood pressure it leads to, headaches. You got these migraine headaches, and you just realize that you've been so stressed out lately that's where these migraines are coming from. Memory loss. You're so stressed out, you start to forget things. Not major things, but you could forget things. Eating disorder. You just don't even want to eat. You just don't want to eat. You lost appetite, or you start binge eating. Disruptive sleep. Your stress, yes, it can lead to you having issues with sleeping at night, where you're like, you know what? I'm having issues. I can't even really sleep. Or you say, I didn't get a good night's sleep last night. That could also increase your heart rate stress, which leads to high blood pressure and high risk of having a heart attack. So we got to evaluate, what am I doing, or what place am I putting myself in that I have to say that I'm stressed? And I have to identify what this stress is. So understanding the level of stress that you have and what is causing that. Very important when we're dealing with this, especially around these holiday times. Self-care. Let's look at this. When stressed out, put that to-do list down. We can't sit and say, I have to do this. And I have a list of things that you have to do. We have to slow down with that whole long list of things we have to do. Prioritize trying to relax. That is very important. Say, you know what? I'm going to take 5 for me. I'm going to take 10 for me. I'm going to take a 20-minute break for me. I'm going to calm down. So prioritize your rest and relaxation. Some stress management tips that have been known to work have been yoga and meditation. And for those that don't have meditation skills or are not enrolled in a yoga class, Google and look up cognitive behavioral therapy and mindfulness and how to quiet your mind. Those are ways to deal with some stress management. Also look up, if you don't know, about muscle relaxation. Just relax. Hot showers. Relax for a little while. Light activities. Take short walks. Quiet drives. Socialize and laughter. Put down the phone texting everybody every 5 minutes. Get off TikTok. Get off YouTube. Get off Facebook. Relax, man. Socialize. Meet a person. Shake a friend's hand. Go to lunch. Prioritize that self-care. We talk about triggers and anxiety and stress management tips. Also, planning stress relief. Taking things one day at a time. Everything ain't gonna get done today. It ain't gonna happen. We like instant coffee. We like instant everything. Some things are gonna take time. So start to prioritize time management. Organize your thoughts. If I have to do a podcast, or I have to do an interview, or I have to do a client session, I have to time block. I have a session from 3 to 4. I have another session 5 to 6. I have dinner with my family. I have to block the times out and have things organized, which is going to lead to stress where I'm like, oh my God, I'm block these times out for time management and moving forward, And finally, we're going to get into what are the effects of stress? Stress, chronic stress leads to other physical and mental disorders, such as not putting things together, forgettingness, and things like that. So remember, there are ways that you can manage your stress, and there are ways in which that you could recognize this stress, such as dealing with parenting, your kids driving you crazy. You got to deal with that. That's a stressor. Finances. How am I going to pay this bill? How is this going to get paid? How is this not going to get paid? How is all this stuff going to happen with me? These are things that we got to say to ourselves. So we got parenting, being a father and a mother. Finances of how am I going to get this Thanksgiving trip done? How am I going to get the Christmas presents? These are things that add to stresses. Your job. You like your job. You hate your job. You like your employees and your coworkers, or you don't. These are more stresses. So identify and recognize these stresses. Relationship. New relationship. Y'all trying to fill each other out. Y'all trying to find out the do's and don'ts. Y'all doing some boundary searching. What's crossing a boundary? What's not crossing a boundary? Leads to stresses, trying to figure someone out in a new or even old relationship. Academics. Those that are in school. Y'all trying to cram right now. Y'all trying to get it all done before the holidays. Because November, you're getting ready for that midterm. Right after the midterm, you're coming right back to school after eating that turkey, and you're going right into the finals. So those that are in academic, especially colleges, with heavy course loads, that 12, 15 plus credit hours, understand that could be a stressor, that academics. Peer pressure. You want to run with your boys. You want to run with your homegirls. They want to do things that maybe you don't want to do, or some things that you're not really financially ready to do. They want to go out and turn up every weekend. You don't got the money, but you want to take some money from one bill, put it to another situation, and make it happen. And then that becomes a stressor because you were trying to keep up with that peer pressure and do what they do. Adjusting to new environments. Some of us have went away to college. Some of us are moving out of homes. Some of us have got put out of homes. Getting ready to adjust to this whole new living situation could be a stressor. So for every area of your life, recognizing some common stressors and having some coping skills to work with those. That's how we get through these issues. Again, as a disclaimer, my name is Dr. Jackson. I'm a licensed mental health counselor in the state of New York. This is a discussion. This is a discussion, informational talk. This is not to be taken as therapy. That's the disclaimer. That please, if you find yourself really stressed out, find a professional. Find someone to talk to. Look on the back of your insurance card and call your insurance provider and ask them, are there ways and methods and somebody that you could talk to with regards to being stressed out or dealing with a mental disorder such as anxiety or depression that may come from being stressed out. Again, Dr. Ulysses Jackson, thank you for stopping by and listening to another Mental Health Monday, and we discuss identifying and managing stress.